A little bit about who you are and a little bit about what you've been going through.
Okay, my name is Jay Gough, and I have had a bad knee since 1982, I think, when I first injured it. And so fast forward, I had 7 surgeries, 2 ACL replacements, and one of the things that I've always been an active person, but one of the saving graces to all that knee issue was that I got into cycling. So I rode my bike a lot. I competed in my 40s and, did things. And so I was pretty happy kind of getting rid of all the other activities. In 2018, I had a bicycle accident on a commute that crushed my femur, and when they repaired that, they didn't really align the old knee as well, and it was instantly starting to bother me more than just normal movement. And over the next few years, it got worse and worse. And pretty soon, and even though I still rode the bike, it didn't really bother me. It got more and more tough to walk on a daily basis. Mm-hmm. And so I had always been paying attention to knee replacements because I knew I would need one, but I was kind of hoping the technology would improve. And just by chance, a mountain bike friend of mine, I ran across out in the desert, and he told me he had just had his knee done, and he told me about Dr. Gough. And so that bumped him onto my list to find out, because I've been collecting names of surgeons for a while. And anyway, came up here, interviewed with him, and was kind of blown away by the technology he was using. Not only, what was kind of new with the knee prosthesis itself, but also I was impressed with the robotic arm and how it assists and how it keeps things what seemingly is more accurate. And and then his other big thing that really kind of sealed the deal for me was he tries really hard not to cut any muscle. Mm-hmm. And having all those surgeries, I knew that that was a lot of the rehab on surgery, mm-hmm. right? And so anyway, so I moved my time frame up because I was going to do a mountain bike event in February, but when he told me he had time to do it and my discomfort with walking, I just decided to bail on the mountain bike event and go for the surgery. So waking up from the surgery and being told that you can't leave the hospital until you walk over to the PT area, and then when you get in there, you think, well, that's okay. And then there's stairs. They make you walk up and down these little therapy stairs, and that was a little intimidating for me. But I was really surprised how I was able to do it without any pain. So the drugs are still kind of going, but I was very thankful, and it gave me a lot of confidence that things might not be so bad, right? And then so we took that opportunity with the those 24-hour nerve blocks, mm-hmm. to go ahead and drive back to Tucson, because mm-hmm. we had driven here to have the surgery. So that worked out okay. A little stiffness, swelling, but part of the deal was that you got this ice machine that you didn't have to fill with ice. It was just like a car radiator coolant. You just turn it on and it starts freezing your leg. And it was really easy to put on and off. And so we set up at the house. I just set up in a recliner and rolled the ice machine on when it started to get uncomfortable, and took it off when I needed to move about. And I was super surprised. I was off the walker within the first day, and moving, confidently, not trying to just grab stuff, but felt confident enough. And then the biggest thing to me was there was really kind of a lack of pain that I was expecting based on all my previous knee surgeries. And then the other thing was the limitation in the movement was just seemed to be the swelling. So that was motivating to slide the ice sheath on and just turn it on and let it would run for 30 minutes at a time, cold and compress. So it would do those things all automated. So you didn't have to think about it. You didn't have to, go get ice out of the refrigerator or however, people do that. And so the first night was pretty tough, maybe first couple of nights sleeping, but I was really surprised probably within the first 5 days of kind of getting off most of the meds, and that helped give me more confidence. And then day 5, I didn't tell my wife, but I was able to figure out how to safely step onto my cycling trainer, and and so I would do 5 minutes like every other day, just 5 minutes. And the first day I remember thinking, oh, my knee isn't gonna push over top of pedal very easily. So we raised the saddle a little, and then that got it going. And as the doctors mentioned to me today, even, as soon as you start moving, the stiffness goes away, as long as you're not cranking it right. So that was a kind of a fun change, in addition to what the physical therapist was giving me for exercises to, to continue to grow with.
That's awesome.
Yeah.
And I heard today, I was in the room earlier, and I heard that you are running up and down the stairs. Is that true?
Yeah. So I first started with to see if I could skip one stair on the left leg, which is the surgery leg. And so I would go up it and then, hold onto the railing coming back down. But within a few weeks, I was starting to get confident of equally weighting both feet. And I probably, I don't know, what are we, 5 weeks now? I mean, I literally just dropped down the stairs moving my feet really quickly the other day. And it's 15 steps. And it was something I used to do with my kids like 20 years ago. And so being able to do that and feel so stable with the knee compared to my unstable one that I had before has just been awesome.
Remarkable. Thanks, Jay.
Yeah.